Guys, Lauren here with Bizrok. In this week's video, I want to talk to you about the patient experience cycle. Now, if you've done any sort of training with us, whether it's communication and language or our exceptional experience training, I know that you've seen this before, okay? But if you haven't, I want you to take a second and hit pause on this video, but start thinking about every single touch point a patient could have with your practice. You know, how do they come to you? What's the first initial phone call? You know, what's the experience like whenever they walk into the office? And really just go through an entire cycle for your patients and how they would interact with your practice. So hit pause. If you've never done this before, hit pause on this video and just start brainstorming what those initial touch points look like for your patient, okay? If you hit pause and you're coming back to this video, welcome back. I'm going to walk you through our patient experience cycle, and hopefully it gets kind of your mind thinking about, ways to increase that interaction, because everything that we do at Bizrok is focused on creating that exceptional experience for your patients, right? So patients have a lot of opportunities and a lot of choices when it comes to dentistry. They have other endo practices they can go to, other ortho practices, other general dental practices they go to. Your patients have options, okay? So what makes them choose us? Well, they choose us because of every interaction that they have with us is always exceptional. So let's walk through this cycle, shall we? So the very first step with the patient experience cycle is how they come to us. How do they hear about us? What are our neighbors and community? What are they saying about us to other patients? Do they see our brand on the ball field at this local school? Do they see us involved in community events? Do they see us at volunteer functions and charity events? How do they come to us? If they're complaining about their dental experience somewhere else, do our own patients chime in and say, hey, I don't know who you go to, but you got to go to my dental practice. So those are the things that I want you to think about, okay? So the very first step in the patient experience is just that. How do they come to us? Whether it's marketing, through a referral, or through our website, which, guys, I know sometimes whenever you get the patient on the phone and you say, hey, how'd you hear about us? I know most of the time their answer is Google, and we all know that they didn't come to us from Google. There's something that drove them to Google us and research us, right? But you still capture it and say, okay, they heard about us from Google, right? That's why Google reviews are so important, so that other of our patients are saying great things about us, and patients hear like, wow, there's 450 5-star reviews. They must be doing something right. And so that very first step is, what's the community saying about us? What is their experience like when they go to our website? Does our website show us? Sometimes docs, I'm gonna beat you up with a little bit of love today, okay? Sometimes you get so stuck on the stock photos and making sure that we have the best possible photo that we can buy online for our website. Guys, can I tell you something? Patients love to see you. They love to see you and your team and see that you guys are real people, not a stock image. You know who has stock images on their website? Corporations. Guys, if you're watching this, I know you're not a corporate office, you're a private practice, you're a real human being who loves your patients. So don't be afraid to share that online. That should be that very first interaction. The next step with the patient experience cycle is that initial phone call. Now, in the past we've done phone training and walking through the experience on how it should sound over the phone, how they're greeted, what's the smile like, can they hear the smile through the phone? But guys, let me ask you this. How many opportunities do our patients get to hear us make that very first impression? It's just one. We have one opportunity to make the first impression the best experience. Have you ever called somewhere and based on how they answered the phone, you were like, wow, I'm not going there. I'm not calling them again. You guys know the companies I'm thinking about, right? So we've all had that experience, but what do patients hear whenever they call our office? How do we treat them? And I know in our phone training, we talk about, even if it's a type of patient that you can never see in your office, maybe you never accept HMO or Medicaid and you're like, Lauren, I'm never going to, it doesn't matter. Did you treat that patient with kindness? Did you try to go above and beyond? Did you educate them? Did you help them to the best of your ability? That way, if anything ever changes in that patient's life, they think about you. They think about the kindness. Or if they can't ever go to you, they're like, you know what? I can't ever go to that practice. I'm on an HMO policy or Medicaid policy, but they were so kind and they were so helpful. So making sure that initial call is absolutely outstanding, okay? The third area is the friendly reminder. Now, I know I've done a video on this before, and you guys know our philosophy when it comes to friendly reminders versus confirmations, but it's making sure that in that friendly reminder call, we're talking up the practice. We're building up authority for the doctor or hygienist or whoever the patient's going to see that day, but we're having that extra step, that extra touch point to better serve our patients. So that's step 3. Step 4 in the patient experience cycle is the greeting, the welcome area. What do patients experience when they walk in your doors for the first time? Now, when you do experience training with us, we do look at the entire experience, and I literally mean before the patient even walks in the door. What's the parking situation like that? Which I realize not all of you can control that, but what's that experience? How can we overcome some obstacles the patient might see? What is the patient experience when they walk through those doors? Is it a warm and friendly welcome? Does it feel like a home? Or does it feel like a dental office? There's 2 different types of emotions that are going to come for the patient based on if it feels like a dental office when they walk in, or if it feels like a home and a great place for them to be, or a spa. Those are some of my favorites. But what's that first experience? And notice I said, it's the welcome area and the greeting. Is there always a team member at front ready to welcome the patient, standing, smiling, welcoming them in? Or is there that awkward exchange whenever the patient walks in the welcome area and there's nobody at the front desk and they're just kind of standing around, looking around, guys? We never want that as an experience for our patients. Last thing I'm going to say about the welcome area. Guys, I know for some of you, if you're coming out of COVID, you probably still have this in your office, or if you've got an old school type office and maybe we haven't renovated for a really long time. Hear me out. The old school glass thing that comes across and shuts patients out. Guys, those are old, they're outdated, and it tells patients that we're not ready to welcome them. It's not a great experience, okay? So if you hear nothing else from this video, guys, if you have one of those sliding glass things, it's time to let it go, all right? So that's all I'm gonna say about that, but trust me, it doesn't create a warm experience. It doesn't welcome the patients. I mean, let's be honest. Would you wanna be welcomed that way if you were walking into a new facility for the first time? Probably not. So think about your patients and that experience, okay? The next part of the patient experience cycle is the patient tour. Now, I won't get into verbiage, but guys, I love the patient tour. It's the experience of every interaction and you bragging about your office and bragging about the flow and your doctors and maybe community involvement that you're in part of, pointing out sterilization, the lab, some extra things that you provide in your office, all those wonderful things. But it's most important that during that patient tour that your patient feels warm and welcome and like, okay, this is a practice that I would like to be a part of for a long term, okay? And then we go to the clinical transition. Now, the reason I have the clinical transition separated from my next step, which is the clinical appointment, is because this is where the hygienist or assistant communicates with the patient. What's that transition like? How are they greeted? If they're a new patient, is there a new patient gift in the operatory welcoming them? What's the experience like? Do we jump in and immediately start doing x-rays and intraorals? Or do we get to know our patient? Do we exchange some pleasantry words? Do we get to know their oral health goals? If you've done communication and language training with us, I know you guys have heard our 3 questions, but that's part of the clinical transition. So don't skip that step. We should absolutely get to know our patients both personally and their dental health goals. Then we can start working on x-rays and intraorals, okay? So that's the clinical transition. The clinical appointment is what the patient's actually there for, whether it's a comprehensive, a limited, they're here for crown prep, root canal, you name it, that's the actual appointment, okay? So it's like, what's that experience like? What's the handoff to the doctor? Does the patient feel welcomed by the doctor? If you're an assistant or you're a hygienist and you're passing an instrument over to the doctor, are you doing it over their face or are you doing it across their chest? Guys, those little things that you have to be focused on during the appointment, that's the actual clinical appointment, all right? So making sure that we're on point and that they have an amazing experience during that time too, because it's not a secret. Oftentimes, patients don't like coming to the dental office. We're all the dental nerds that loved going to see the dentist when we were growing up. Oftentimes, our patients aren't. So you want to make sure that you have a great experience when they're in your chair and whenever they're interacting with your doctor. Last couple ones, we have the checkout or treatment experience. Now, whether the patient has treatment or not, you always want to hand them out off properly. So introducing the patient to the checkout or treatment coordinator is super important. Even if they've been there for years, still do a proper handoff, okay? And then always telling and communicating with that key team member what the patient was there for that day. Now guys, the reason I love this is because it's a quick checks and balances to communicate to your team if anything was changed for the day, but it also allows the checkout or treatment coordinator to double check everything that was done that day. So maybe there was a different provider. Maybe originally it was Dr. A attached to the treatment or the appointment that day, but actually Dr. B did all of the treatment. So you want to make sure that you present that to your team member, but also you remind the patient of what was done that day, and then what they need to come back in for if the next appointment's scheduled, if they have any questions. So you want to make sure that that transition is fluid and on point. Now, clinicians, the most important question you could ever ask your patient during that transition, and I know you're like, Lauren, I do this in the chair, but hear me out, is asking the patient, do you have any other clinical questions for me before Susie checks you out? Now, I know for some of you, you're like, Lauren, I always ask that in the operatory. Guys, I know you do. I know you do. You're an expert, right? And you're like, I would never take my patient up front before I ask them that question. I want you to keep doing that, okay? But I want you to ask it one more time at the checkout because it gives the patient one more opportunity to ask a clinical question that maybe the front office can't answer. And so you want to make sure that you're giving that patient the lifeline of, are you sure you don't have any other clinical questions for me before Susie checks you out, okay? Help your front office team members too. Like, let them off the hook so that they don't have to play expert clinician, because some of them are, but some of them aren't. And so it becomes a really awkward conversation. I like to have clinical conversations in the back or with the clinician, and then money conversations and appointment conversations should really be focused up front, okay? Last couple ones, we have the review and the referral. Now, this is mostly for the front office team. Front office team, if you know that your patients are having an exceptional experience and that your team has done all of the wonderful things to provide that exceptional experience, how easy is it for you to ask about their experience? You already know the answer. You're like, gosh, we have an amazing experience. It gives you the freedom and the confidence to say, Susie patient, how was your appointment with our hygienist today? Now, when your patient's like, oh, she was amazing, she went above and beyond, like all those things, that's when you can ask for the review or referral. So don't skip that step. You should be able to ask every single patient that question every single time, which again, if everybody's providing an exceptional experience and everyone's always going above and beyond, we already know the answer to that question. Fair? And then the very last step in the patient experience cycle is the post-appointment call. Now, we don't always do this step because sometimes our patients don't need it. Like if they're just here for a standard appointment, obviously I'm not saying go call your patient, right? But this is for the patients that maybe they had invasive treatment or some sort of surgical procedure, or if the patient was really nervous and even started asking a lot of questions at the end of their appointment. Now guys, for you, even if you're like, that was such an easy appointment, they shouldn't have been freaking out, it doesn't matter. What would our patient want? What do they deserve? And so if you're like, I need to check on my patient, or I think I should check on my patient, you should absolutely check on your patient, okay? So making sure that that post-appointment call is handled, I would say within 24 hours. I like the end of the day if their appointment was today before lunch. If it's a little later in the afternoon, obviously you don't have to call them right away. But some of our offices will call like 7 or 8 o'clock at night because they're like, okay, it's been a few hours since they were in and I just want to talk to them before they go to bed and just make sure that everything's still good and explain to them about the swelling or pain and all of those other questions. If not, make sure that there's a process or a note in the system to follow up with the patient first thing the next morning. So guys, if you're willing to follow some of these and implement just a few of these things, I'm telling you, you will have an exceptional patient experience, but it starts with every single interaction. And thinking back to that patient experience cycle, guys, it's not on one person. You know, oftentimes clinicians and doctors will kind of point you out because you're like, Lauren, I know I'm an amazing doctor and I know I go above and beyond and I go to all these CE courses and I'm an expert in whatever. Guys, that's so important. But if you look at the patient experience cycle, the clinical appointment at best is about 10 to 15% of the entire cycle. So we don't always get rewarded for just being a great clinician, okay? So we get rewarded by being exceptional in every single interaction with our patient. So make sure that you focus on each of these. And for some of you, if you're like, gosh, I don't even know where to begin, guys, start at step one. Just say, what's the experience like whenever people go to our website? What's the experience like whenever they ask others about us? Just focus there, and then go to the initial call, and then go to the welcome area and the greeting. Guys, just go one step at a time. You don't have to tackle the entire cycle overnight. Just start somewhere, okay? And before you know it, you'll have an exceptional experience, and you'll have more patients coming to see you in no time. As always, guys, if you need help, if there's anything we can do to help or serve you, please reach out. Otherwise, we look forward to seeing you and serving you soon.